All right, so moving on to injectable therapies. Corticosteroid injections, they get utilised a lot by sports medicine. I guess, what is the purpose of a corticosteroid injection, and who is considered a good candidate for a corticosteroid injection?
Yeah, again, it's case by case, patient to patient. So the main purpose of corticosteroid injections, it's an anti-inflammatory medication that, rather than taken as a tablet, we're injecting directly into its relevant body part. And with the anti-inflammatory properties, it can reduce certain inflammatory conditions and injuries, and also reduce pain as well, to ensure a faster return to play. So it's useful in some cases where if we think that the relevant injury is a stable injury, that it's fine to inject, but there is also certain injuries that you don't want to inject, and you want to know if it's painful, if it's inflamed, if it's angry, because pain in those situations is actually a good utility tool to use, because it can guide your recovery as well. So it takes a lot of careful planning and discussion with the athletes, and also coaching staff, performance staff as well, before we make that decision to inject or not, and we'll always ever do it in a safe manner.
For sure, absolutely. And what are your thoughts surrounding injecting tendons, and maybe some other kind of risk factors? So there's a bit of a mixed advice out there in regards to injecting tendons.
Yeah, definitely, So there's specific tendons that we will always avoid, and the main one that the literature will suggest is Achilles tendon. So we rarely inject Achilles tendons due to its risk of causing further damage. But what we're finding is that majority of other non-load-bearing tendons are actually quite safe to inject, as long as you supplement it with like other forms of treatment as well, and that most includes your strength and conditioning rehab. The corticosteroid is there purely to help with the pain and also the inflammatory response following an injury, but it's still important that the tendon still needs to heal with more natural measures, and that can just be time and also the strength and conditioning as well. So I would never suggest purely just relying on just a cortisone injection and nothing else. It takes a mix of different treatments in order to get a successful outcome.
Absolutely. And would you say that it's okay in certain situations to maybe inject the tendon sheath or the fluid, rather than the actual tendon in some situations?
So that's one way to minimize potential complications of the actual injection. There's different techniques that we can use when it comes to injecting, and the luxury of technology now is that we do all our injections with ultrasound guidance, meaning that we use an ultrasound probe to actually visualize the internal structures, and we can actually position the needle to the millimeter where we want the injection and the medication to go.
Absolutely. Great, that's awesome.